We've heard a lot about this, the FDA approving that antiviral drug Remdesivir as treatment for coronavirus. But the question is, will a lot of people have access to it now?
And why do some coronavirus patients lose their sense of smell, and how long does that last? Dr. Marc Kerner, who's an ear, nose, and throat specialist with Cal West ENT, is with us now to answer those questions. Dr. Kerner, thanks for joining us. We appreciate it. Good morning. First question, let's get to the approval of Remdesivir. Do you think that it will now become more widely used?
Well, as you know, it's been approved for use in hospitalized patients. So it's not that it's going to be widely available yet for on patients on an outpatient basis, but it's really being used for people that are in the hospital and that are requiring in-hospital care. What it does do is it shortens the length of time that you have the viral infection. So I think as we get more experience with it and there's more studies being done on patients as an outpatient, it probably will be more widely used.
And now that we're 7 months into this here in the U.S., a lot of people have said that they've lost their sense of smell or taste. That's a symptom you might have COVID-19. So How long is that now typically lasting that you're hearing about? And is there anything that these people can do to get that back?
Sure. So we're seeing a number of these patients in our practice because as ear, nose, and throat specialists, this is what we do all the time. So we're seeing patients, we've had some that have lasted as long as 9 months, sometimes loss of smell will stay with us. It can last up to a year, but we've had patients that have gotten better within 3 or 4 days. So it just varies on the person.
Is there something they can do to get it back if they're concerned, or is it just it's up to Mother Nature and your body to figure it out?
Sure. Well, there really isn't any therapy, and there really isn't anything other than potentially steroids. So we do give them steroids, which does help. And steroids are now one of the first line treatments of coronavirus cases that we're seeing in the hospital. The other thing that we're doing with them is once they've had that loss of smell, we actually use essential oils, which can be used to trigger the olfactory nerves and try to regain that by just by giving them essential oils, which can help trigger that sense of smell to return.
Would that be like Ponaris?
Yeah. Well, Ponaris is an emollient. That's really more of a lubricant for the nose. And that certainly won't hurt. But the essential oils that have different fragrances, we use that to help trigger those nerves and help allow those to regenerate.
Okay. All right. Dr. Kerner, we appreciate it. Thanks so much.
You got it. Thank you.